Military service is associated with a number of physical and psychological stressors. Do these issues lead to higher rates of medical illnesses and poorer overall health for military veterans compared to the general population? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Military service, as I said in the opening, it is associated with so many, mostly physical stressors, but also psychological stressors. Deploying to overseas missions, taking part in combat operations, suffering a traumatic injury, physical injury for sure, and then reintegrating back into civilian life. All of those have been shown to have negative effects on a veteran's physical well-being, but also psychological well-being, and those may not manifest until many years later. Along the same lines, there's the issue of maintaining levels of physical fitness and maintaining height and weight standards in accordance with the standards of military service. And those put a lot of stress on active duty service members. They have to meet certain weight requirements, height requirements, and those are evaluated every 6 months or so just to be able to stay in the military. To meet weight standards, some service members resort to unhealthy behaviors, excessive exercise, fasting, skipping meals, even inducing vomiting. And studies have shown these unhealthy behaviors can lead to maladaptive eating behaviors and so much else later in life, binge eating, vomiting, emotional eating that contribute to obesity. There was a 2021 study looking at health outcomes for U.S. military veterans compared to non-veterans, and it went over a 16-year period. And the researchers found out that veterans had much higher rates of things like stroke, skin cancer, all sorts of cancers, COPD, arthritis, kidney disease, diabetes. And it shows that veteran populations are significantly less healthy than non-veterans. And then males typically had higher rates of being overweight, higher rates of heart disease, stroke, skin cancer, and diabetes than the female veterans. There was also, in that study, found that veterans were less likely to report these medical disorders. And so the VA maybe ought to think about some of these medical conditions as presumptive conditions in VA disability claims. There have been other studies, again, looking at veterans and non-veterans, look at potential reasons why veterans have worse health outcomes. That second study showed veterans had higher rates for all the medical conditions and comorbidities that they investigated. Overweight and obese status, heart disease, stroke, again, skin cancer, arthritis, kidney disease, and diabetes, and other mental health diseases. If you have ideas for topics for future videos for this channel, whether that's injuries, medical conditions, risk factors, Nexus letters, DBQs, or anything else, leave those in the comments below this video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video. If you are interested in a Nexus letter for your injury or medical condition, click the link in the description below to learn more about working with me and working with my team. We do everything we can to make the process easy and to make it quick, and I try to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.